The survival of his signature achievement now depends on Republicans being unable to work out their differences. They can only afford to lose 2 Senate Republicans, Vlad, and as you can see, there are far more of them right now that are holding out.
Absolutely. And Nancy, you mentioned the new bill will roll back the expansion of Medicaid, which matches the House bill. But talk me through some of the differences. How does the Senate bill differ from the House's?
Well, it conducts that rollback more slowly, for one, though eventually both bills kind of reach the same place. It leaves more of Obamacare's tax credits in place than the House version does. You'll recall that President Trump described the House version as mean recently, and so Senate leaders were kind of trying to split the difference, but now you've got conservatives like Rand Paul and Ted Cruz arguing that essentially this bill amounts to Obamacare light. There are other differences as well. One of the big controversies surrounding the House bill was that it eliminated some of Obamacare's protections for people with pre-existing conditions. That was meant to bring premiums down for everyone, but there were many on the right and the left who feared that it would leave people with pre-existing conditions out in the cold altogether, that they simply wouldn't be able to afford insurance. So the Senate bill leaves those protections in place.
And according to the Congressional Budget Office, the House bill would have caused 23 million more Americans to lose health insurance. When will we get the CBO score of the Senate's plan?
The Congressional Budget Office says that we will see that score early next week. And you have a number of Senate Republicans who are just going to hold off on coming down either in favor of this bill or against it until they see that score. If the CBO determines that, let's say, the Senate version is far more expensive than the House version, or that there's a number of uninsured close to the House version, that 23 million, that's going to be a big cause for concern for moderates and conservatives alike. And you can see how narrow the margin of error is for Republican leaders, because they want to hold a vote next week, late next week, and they're basically in a holding pattern until we see that CBO score.
And so what are the chances of having that vote next week, Nancy? What are you hearing?
Well, you know, there are so many factors at play here. There's the CBO score. There's the fact that Senate Republican leaders have said that they're willing to allow unlimited amendments to this bill on the Senate floor. That eats up a lot of time. And then the most basic challenge that they have right now is that they've got conservatives who say that the bill is too generous, too much like Obamacare, and they've got moderates who say that the bill is too draconian, particularly when it comes to Medicaid. They can't do anything to satisfy one wing of the party without angering the other wing. So the question is, what exactly do they do? How do they tweak this bill? And they've only got a couple days to do it if they want to meet their deadline, that ends up bringing in 50 of the 52 Republican members of the Senate Republican caucus.
All right, Nancy Cordes reporting for us on the Hill. Thank you, Nancy.
You're welcome.